Hello! So let's talk about our topic today. Very exciting. It's what does spotting mean? So let's talk about spotting, what it means, and why it happens. So I'm sure at some stage or another we've all experienced some type of spotting at some point in our lives. And don't get me wrong, I love a good spot on clothing, but I'm not really a fan of unexpected spotting in the underwear, which I'm sure you can agree with. Hello again, and I'm so thrilled to be here today. For those of you that don't know me, my name is Michelle Cooke. I'm a hormone and fertility naturopath. I'm a natural fertility educator, and I'm a naturopathic emotional release practitioner. I'm the founder and director of Reproductive Wellness, a clinic based in Melbourne, and I see patients online and face to face. So if you have any questions as we go through the live this evening, be sure to pop them in the comments box down below, or if you're watching the replay, you can pop it in there. And I'll go ahead and answer those for you. Now, if you are enjoying the content today, just make sure that you hit the likes and loves so that I know that you're enjoying what we're going through today. So let's get into it. So, all about spotting. So, spotting is actually defined as a very light bleed, which is taking place outside your period. So, therefore, the bleed isn't a result of having your period. Now, it's noticeable enough, but it's not enough blood to actually soak a tampon or a pad. And it's not heavy enough to warrant using either a pad or tampon either. Spotting is different to your period, which is due to the shedding of the endometrial lining, which is your uterine lining. So very, very different, and there's different reasons why spotting can take place. So I'll be sure to cover those with you as we go through. So the spotting bleed can either come from the lower reproductive tract, so for example in the cervix or the vagina, or it can come from higher up, so from the upper reproductive tract, so for instance your uterus. If the bleed is lighter, it is generally from the lower or the upper reproductive tract, so either from the vagina, cervix or uterus. Whereas if the bleed is a little bit heavier, so if the spotting's a bit heavier, that's generally from higher up in the reproductive tract, so for instance from your uterus, as a rule of thumb. Now, characteristics, so it might be brown in colour. Oh, sorry, just a second. So the bleed might actually be brown in colour or pink. It could be either or, it just depends why you're actually getting the spotting. And the bleed is in a lighter amount compared to what your period would be like, for instance. There's variations in the time frame as well, so you might sort of spot for one day, for example, then there might be, it might stop again, and then it might start up again later on. Or it could just be for that one moment, or you could continuously spot in a row, which may go for approximately 3 days maximum, for instance. Now the causes, so let's get into this. So there's lots of different reasons why it can happen, and these are some of the potential contributing factors or causes of spotting, just so you know. So one of them could be ovulation. So it takes place around the time of ovulation, usually in the middle of the cycle. If your ovulation is synced correctly, technically it should be straight sort of smack bang in the middle, and then about 2 weeks after you get your period. And usually this is kind of that pinkish tinge to it, so there'll be more of a pinkish blood. However, it could be brown in some cases as well, but generally it's more that pink tinge to the cervical mucus that's being produced at that time. Now, pregnancy, that's another reason why it could happen. So actually 1 in 4 women can experience this between weeks 5 and 8, or 1 to 4 weeks after your period, when it was due to be expected, it might actually occur then. And it's a common symptom of early pregnancy for some women. So in the first trimester, it could be due to changes in the cervix that are taking place, hormonal changes, having sex during that time of being pregnant, or due to implantation. If it's heavier spotting or bleeding, this may be potential for concern. So I'll discuss a bit more about that as we go through. So implantation bleeding, as I mentioned, spotting can occur due to that. So it can be early on as a result of the embryo actually implanting. And it usually only lasts for a day or two, and it generally takes place about a week after ovulation or around a week before your period is actually due. Breastfeeding is a big one, so we know that breastfeeding actually suppresses ovulation, but some women can actually still experience spotting due to the hormonal changes associated with pregnancy. Also, when the body is preparing to ovulate, so if you're starting to wean on your breastfeeding experience, the body will have sort of several tries at trying to ovulate, and this is when spotting may actually occur as well. Stress is another one, so that alters your hormone production because your body goes into survival mode. It's protecting you from the perceived danger, whether it's life-threatening or not. Your body can't tell the difference, so it's not a safe time to reproduce. So as a result, the pregnenolone hormone that's produced is stolen away to produce cortisol, and cortisol is so pregnenolone will turn into cortisol, so it's the precursor hormone, and cortisol will actually help you adapt to that stress so that you can cope with it effectively. But as a result, that pregnenolone is stolen away, so that's actually a precursor hormone to progesterone, so as a result that isn't produced, and also due to the stress that causes your ovulation to be delayed or stopped. And you won't produce sufficient amount of progesterone then in the luteal phase, because if you don't ovulate, the follicle isn't released, you won't have a corpus luteum to actually maintain that progesterone level in the luteal phase. So that's an issue as well, because low progesterone as well can arise in spotting too. Thyroid issues is another one as well, so that can cause spotting throughout your menstrual cycle, so in between the periods. PCOS is another one. Perimenopause, so that journey towards menopause can be quite disruptive in terms of hormones and things like that, and because of all the hormonal changes, spotting can also happen as well. Injury as well, so if you've got an injury to your uterus, to your cervix or vagina, that can cause abnormal spotting as well. Rough sex as well, that could be a cause of spotting too, because of the trauma and friction to the area. I'll speak a little bit more about that as we go through too. Miscarriage, so that can range from spotting to more of a heavier bleed, but that's another reason why it can happen too. The oral contraceptive pill, so this tends to happen when you start a new pill, if you've just started on it, and it should tend to stop sort of a few months later. And it usually happens as you adjust to the contraceptive, but if you are still experiencing spotting, or it's called breakthrough bleeding, in between your withdrawal bleed, because remember when you're on oral contraceptives you actually don't get a period, it's a withdrawal bleed in response to the synthetic hormones that you're taking. And if that happens, if you're getting the breakthrough bleeding, which is spotting, as well as the withdrawal bleed, it might not be the correct oral contraceptive for you. So it's worth asking more about that, whether it's appropriate. Other contraceptives will cause spotting as well. So things like implants, injections, hormonal IUDs as well. And again, spotting may occur sort of the first few months as you're on it, and generally it sort of adjusts to them, and it shouldn't kind of happen after that. Ectopic pregnancy, so this is another one as well. So when a fertilized egg is actually implanting outside of the uterus, and it tends to be sort of within the fallopian tubes, this will result in spotting, and other symptoms can be dizziness, shoulder pain, abdominal pain along with that as well. So if you're concerned, just make sure you get investigated for that. Low progesterone, so this is a biggie and quite a common one that can result in spotting as well, particularly if it's occurring in the luteal phase, so the second phase of your cycle, so post ovulation, if spotting is happening then. And if you've got a short luteal phase, that's going to make it more likely for you to experience spotting as well. Another reason could be fibroids, so non-cancerous growths that are found in the uterus that can result in spotting. Endometriosis, so that's when tissue that's similar to that of the endometrial lining is growing elsewhere where it shouldn't be. So maybe it's on the bowel, maybe it's on the bladder, etc., or within the endometrial cavity somewhere, and that tends to increase the risk of spotting as well. Cervical polyps is another one, so when abnormal growths form on your cervix or inside your uterus as well. Spotting that's happening after sex, so that could be a potential reason as well. It's normal, of course, if it's your first time having sex, there may be a bit of spotting and a little bit of a bleed, and that's perfectly normal, but it's outside of that, it's not normal for it to be happening if you're experiencing after sex, because it could mean that you've got polyps or you've got an issue with your cervix. There could be endometriosis as well, or there could be sexually transmitted infections, and this could indicate that another indication is that there might be dryness there at the vaginal tissue. So there's a lack of moisture and hydration there. So this could be due to a hormonal imbalance as well. And it's just getting irritated from the friction and penetration of the penis, and it's causing a little bit of a bleed there. So it's important to investigate, is it due to a hormonal imbalance, and just make sure that that's addressed. In the meantime, using a lube can sort of help until you get to the bottom of why it's actually occurring for you. Evening primrose capsules are quite good as well, so you can take them internally to actually hydrate the tissues of the vagina and the uterus, and you can also actually split open the capsules and apply that topically. Just remember, if you're using lube as well, if you're using that in conjunction with condoms, it needs to be a water-based lubricant, because if it's an oil-based lubricant, it can actually break down the condom, so not ideal if you don't want that little uh-oh surprise. Otherwise, you can use an oil-based lubricant, and that's perfectly fine. Some good lubes to use that are natural and don't contain toxins and they don't impact the pH of the vagina is lubes called Bonk. That's a really good one. They've actually got a water-based and an oil-based lubricant that's perfectly fine to be using. Another option would be Silk, so SYLK. That's another option as well. There's a few other ones too, but those ones are particularly good. Now, as I mentioned, so sexually transmitted infections, for example, gonorrhea and chlamydia, for instance, can cause spotting as well. So it's important to get that investigated. You might sort of notice other symptoms too. So there might be sort of burning when you do a wee as well, along with the spotting too. So yeah, if you're concerned, just make sure that you get investigated for that. Pelvic inflammatory disease, so symptoms include spotting, There's pain in the lower abdomen commonly as well, and there may be fever or vaginal discharge with that as well. And this can happen if sexually transmitted infections aren't actually treated. This can end up in pelvic inflammation and pelvic inflammatory disease as a result. It's very serious. If you do have that, you need to get it treated urgently because it can actually cause infection in your fallopian tubes, for example, and it can cause a lot of scar tissue buildup as a result if you don't actually treat it. And if you're trying to get pregnant, it can cause infertility issues. So it's important to get onto that. Another reason could be, and this is quite drastic, so it might not often be the case, but it's important to mention it. So cancer is another one. So these types of cancer can result in spotting. So it might be ovarian, it could be uterine, it could be cervical, or it could be vaginal. So generally at the end of the day, if you're experiencing spotting and you're not sure if it's just stress or due to ovulation or something like that, and you're concerned about it, just please make sure that you get investigated further at the end of the day. So what can help further spotting from happening? So it depends why it's happening. As you can see, there's a whole realm as to why spotting is actually taking place. It may be okay if it's considered a normal occurrence. For instance, if it's happening with breastfeeding, that's quite a common thing that may be happening. With the implantation, that could potentially happen, or ovulation, you might not actually have to be concerned about that. It's more if it's due to an actual condition, so the conditions that I mentioned earlier, so things like endometriosis, PCOS, fibroids, polyps and things like that. If it's occurring after sex, I would definitely get investigated. If it's due to low progesterone, miscarriage, thyroid issues, stress, etc., it needs to be investigated and treated accordingly. So I would actually recommend a thorough investigation, so making sure that you get your hormones tested, so things like estrogen, progesterone, testosterone, FSH, LH, just to see what's going on there. Vitamins and minerals, so just looking at what the status is like that there. Remembering that they sort of influence hormone production and hormone regulation and imbalance and balance, etc. So it's important to have a look there. Thyroid testing as well, and when I speak about thyroid, I don't mean TSH. So thyroid stimulating hormone is commonly tested when you go to the GP, and it's no fault of the GP. It's actually Medicare sort of making sure that the doctor isn't doing excessive testing each year and with each patient. So unless your TSH is well out of range, so generally, the range goes from 0.5 to 4. If you're well outside that, that's may warrant testing for T4 and T3, which is your thyroid hormones. But it's not commonly done unless things are wonky with TSH. But the thing we've got to remember is TSH is just the start of things to come. It's just simply tapping on the shoulder of your thyroid and telling your thyroid to produce T4, which is one of your thyroid hormones. So it's only one part of a very small picture. We need a lot more information than that. We need to know what T4 is. As I mentioned, that's your thyroid hormone. We need to know what T3 is like. So T3 is produced when T4 converts to T3, and T3 is the active thyroid hormone in the body, so we need that to be ample as well, because you could have normal TSH, but your T4 and T3 may be abnormal. They might be high or low, but we wouldn't know because TSH looks normal. So it's very, very important that you get those tested as well. As well as that, I'd be looking at thyroid antibodies because they influence how the thyroid works. If you have thyroid antibodies, it's indicating that your body is starting to actually attack your own thyroid gland. It's not recognizing it as self. and it's actually attacking it. If the thyroid antibodies are low, it's already starting to attack. We don't want it to get any higher because it ends up being autoimmune disease like Graves' disease or Hashimoto's thyroiditis, and you'll end up being on medication for life with those particular conditions if the degree of antibodies goes up and the degree of damage and attack to the thyroid continues. So it's important to look at that as well. The other thing to look at is iodine as well. So that's a urinary test, and we need enough iodine for the thyroid to be functioning normally. So it's very, very important to get that checked as well. So that's at the very least, all those things. And if possible, reverse T3. So reverse T3 is when T4 is actually being shunted down a different pathway. So instead of producing T3, it's producing reverse T3, which means that you won't have enough of your active T3 hormone. So it's important to look at that possibly, but definitely the others are highly indicated. And even if it means that you have to pay for it, because you generally do, just say that you're happy to actually go ahead and pay for it out of pocket. It's not covered by Medicare if you get all of those things done, but it's really well worth looking at just to see what's going on there. Another thing I would look at is adrenal testing. So remember, as I mentioned, stress can be a cause of spotting. So if you've got high cortisol, that's an indication that you're actually experiencing stress. So you can actually measure this through a blood test. So it will look at cortisol levels first thing in the morning. It can be sort of hard to get accurate results on the blood test, to be honest, because you have to be quite relaxed and not stressed, and sometimes you're in traffic trying to get to the pathology centre and you're a little bit stressed, and it can kind of make the cortisol a little bit higher than it should be, if that makes sense. But it is a good measure if you wanted to look at that, and it's generally covered by Medicare, so it won't cost you out of pocket. Another ideal one would be to look at salivary adrenal testing. So this looks at your cortisol over the duration of the day, because there's peaks and troughs as the day goes through. So generally you take 4 samples. So one would be in the morning between 6 and 8. Second one would be at 12 midday. The third one, sorry, I can't even count. The third one would be at around sort of 4 p.m. and the last one is around 8 p.m. or kind of just after dinner, around that kind of time. So it's looking at what they're doing. So essentially what it should be is you get up in the morning, cortisol should be at its highest, and over the day it should start to drop. Once you reach the evening, it should be fully dropped away, and then melatonin will take over, because melatonin and cortisol sort of seesaw all day. So when one's up, the other should be down. So it sort of gives you an understanding of what it's doing. Is it, too high in the morning? Is it too low in the morning, etc. At those different time points, you can see what the issue is and compare it. And there's lots of herbs and nutrients that can actually bring your thyroid back into balance and actually support it, help it adapt to stress, and either reduce high cortisol levels or increase low cortisol levels. Because over time, if you're experiencing extensive stress, your body isn't sort of designed to experience stress over a long period of time. So if that happens, your body can get quite depleted and there's nothing left in the tank. There's not enough cortisol to help you adapt to that stress. So that's another thing I would recommend looking at as well. Now, what would I recommend doing if you have spotting? So if you're not sure if the spotting is a concern or not, as I mentioned, I would take a little trip to the GP just to double check and make sure that it's not a concerning thing. And a thorough investigation into why you're experiencing spotting is very important. Whether it be once off or recurrent, it's essential for future prevention, because it's not ideal for it to happen. So being referred to your GP and potentially a gynecologist if they think that's indicated. So if they're kind of thinking, oh, she might have endometriosis or fibroids or polyps, or needs to have an internal investigation there, so getting, a transvaginal ultrasound. A lot of those conditions, though, you can't sort of rely upon the ultrasound alone. It's very, very important to actually go in laparoscopy, which is the keyhole surgery, and go in and have a good look that way, just to doubly make sure. Having both is actually good, because I have had some patients that have had the laparoscopy, they've gone in to try and find the polyp or the fibroid, and it looks like it's not there, but it's actually hiding behind something. So the ultrasound can kind of bring that to light as well, just to see if it's actually there and kind of hidden behind one of the structures found in the uterine cavity. Also, I would recommend booking in with a naturopath, so someone that specializes in hormones and fertility. And hello, FYI, that's what I do. I would absolutely love to help you if that's happening with you. I would absolutely love to help. So naturopaths take a rather thorough approach to treatment. So we look at your pathology testing very differently, as I've mentioned in previous videos. GPs will look at the pathology range, which is very broad. If you fall outside that pathology range, that's when they act, because they're trained from an emergency room perspective. So if you present with disease, that's when they take action. Whereas naturopaths are more preventative, so there's an optimal range between that broad range, and we like to see between that. Because if you've fallen out of the optimum range, this will usually present with symptoms, you'll feel awful, and you'll still, you won't feel the best if you're actually out of that optimum range, but you're still within range, if that makes sense. So that's what we try and aim for, sort of preventing that full-blown disease before it actually gets to that state. Also, I just wanted to make it clear that normal test results won't help you. Okay, so if you've been to a GP and they've told you that everything's normal, they're looking at that broad pathology range. If you're not completely out of that, they'll act. Remember that. So you're still experiencing symptoms and you're not feeling the best and you're wondering why, that will be why. So they'll tell you you're normal, but you're actually not. And in that instance, I would actually take your results and bring it to a naturopath to have a look at in a different light for you, just so you can address those symptoms and start feeling better. Now, let me just see if there's anything else that I needed to say. Yeah, and obviously with visiting a naturopath too, we look at things like vitamin and mineral ranges too, to make sure that's optimal, because as I discussed, that's really important for hormone balance. And also testing hormones on the right day. I can't stress enough how often it happens where all the hormones are tested on the same day. It's just really hard to read, and it's not going to give you an accurate understanding of what's happening. We need to remember that on day 2 or 3 of your period, we need to look at estrogen, we need to look at FSH, LH. When we get to sort of day 14 or 7 days post-ovulation, that's when we're actually looking at progesterone levels. The rest of the hormones don't matter so much, but those other ones do. It needs to be tested on those days, otherwise it's just simply too hard to read, and I just wouldn't bother. Is there any questions on what I've covered? I'm just going to check Facebook as well, just in case. And anyone got any here? But if you're a little bit too shy, that's all good. You can pop a comment in the box down below. So if you're watching on Facebook, you can pop it down there. If you're watching on Instagram, you can pop it on after I share the live, or you can send me a DM or PM, and I'm more than happy to answer that for you. So as I said, if you're experiencing spotting and you would like the assistance of a naturopath, I would absolutely love to help you. What I would suggest is actually booking in for a free 15-minute discovery call where we can discuss what's involved, what we actually do together, and if we're actually a right fit for each other, because I feel that that's very important too. If you're watching on Instagram or Facebook, I will pop that link down in the comments below. If you're watching on YouTube, I'll pop it down below for you. Actually, on Instagram, the link is in the bio if you're wanting to book a free discovery call. And I'd like to thank you so very much for watching this evening. I've thoroughly enjoyed talking about it. And basically I go live every Wednesday, 7:30 p.m. Australian Eastern Standard Time, and I'm either discussing something about periods, menstrual cycles, hormones, or fertility. So I look forward to seeing you next week. And don't forget, if you're watching on YouTube, be sure to like and subscribe. And just an FYI, if you want to see all the lives that I've done thus far, they're all on my blog, on my website, which is www.reproductivewellness.com.au/blog. So they're all there as well if you want to go through them. But thank you so much again, and I'll see you next week. Thank you. Bye.